everyone. Peter Gusky with the Backsaver System. I want to talk about an exercise today, a very effective exercise with regard to reducing pain in the knees. Here's the way it works. With this exercise, please keep in mind as an overall guiding principle that you are not to push this exercise hard. You only want to feel a mild, dull stretch during this exercise, never any out-and-out pain. Here's the way it works. You hold on to something such as a table like this or a chair that's just for balance. Take the leg where you're having the knee pain in and gently pull it up until you feel a mild, dull stretch and no further than where you feel a mild, dull stretch in either the knee itself, over the top of the knee, or in the thigh muscle. Some people, when they do this exercise, they don't feel much in the knee, at least not much of a stretch. They just feel it in their thigh muscle. That's fine. There's nothing wrong with that. You're still getting the effect of the exercise with regard to reducing pain in the knee. When you do this exercise, each and every time that you do it, hold the position where you feel that mild, dull stretch for a full 30 seconds. Some people with advanced knee pain or arthritic changes in their knees, they will not be able to pull their leg this far. Even going to this position where they can't yet reach it with their hand, already that produces the mild, dull stretch. If they were to pull it up this far, they would feel out and out pain. I don't want you pulling that hard. All I want you to feel is a mild, dull stretch. If it is the case with you that already here you're feeling that dull stretch in your thigh or knee, then don't go any further. Take a towel, wrap it around your ankle or a piece of rope, and pull with your hand in order to get the mild, dull stretch. If it is the case that if you pull this far up, you're already getting into the pain zone, and I don't want you to get into that. Again, I repeat it oftentimes, and it can't be repeated often enough. All you want to produce is a mild, dull stretch in either the knee or the thigh, and you hold it in that position for 30 seconds. After, anywhere from a day to a week of doing this exercise, you won't feel much of a stretch anymore, so you need to progress the exercise. And the next progression from here, after you don't feel much of a stretch in this position anymore, is to move your hand positioning. You then place your hand underneath the front of your foot. This will induce a little bit more of a stretch in the thigh or knee, and you'll again feel that mild, dull stretch, which produces the therapeutic effect. After, anywhere from a day to a week of doing it in this position, again, you won't feel much of a stretch anymore. So you now, to progress it further, rotate your hand to the inside of the foot. This induces a mild rotation into the knee as well as an additional further stretch. After you don't feel much in this position anymore, the next progression is to arch the lower back while pulling the leg back slightly further. The next progression after that, after you don't feel much of a stretch in this position anymore, is to keep your hand on the inside of the foot, keep the leg pulled back, arch your lower back as before, and now rotate your body progressively and slowly forward until you feel that mild, dull stretch again, ideally getting your body to about where it's parallel to the floor. Each and every time that you do this exercise, hold that mild, dull stretch position for a full 30 seconds. And this exercise needs to be done 3 times per day. You'll find it to be very effective, the single most effective exercise I found for reducing knee pain.